Hey everyone, welcome to the live stream today. I'm excited to see you all here to participate with me on this Thursday. I can see already we've got some members in, and Marissa is here, Ron is here, Lillian I can see, I like pie. And it looks like we've actually got some new members to the channel today. I'm so excited. Terry, welcome to Silver membership. Ashley, welcome to Platinum membership. Barefoot Farm, welcome to Silver membership. So if you're not currently a member, you don't have to become a paid member, but there are some perks that you can get from joining membership for the channel, including that you get... Oh, why am I not going? No, maybe. No, I guess I am going. Okay, so if you guys could just say hi to me right now, because I'm having some technical issues. I'm not sure it's showing that I'm streaming it, but I don't know, guys, because it's it's not showing anything on my stream. So anyway, you do not have to join paid membership, but there are certain perks you get for them. So I give all of my free members. There are a couple of courses that I offer just to my paid members that they are. Oh, thank you, Marissa. There's a few courses that I offer just to the paid channel members, and you can get CEUs for them. One is on ICD-10 coding. I believe the other is on evaluation and management coding. So let me close out of that window then, because I don't even need that. So hello, everyone. Hello, Suze. Hello, Mary. Hello, Swapnil. It's great to see you all today. I wanted to come in today and do my AMAs like I like to do, because I've just had so many questions. I have a couple of things that I did want to cover too, just in general as well. Good morning. I know it's still early for some of you though on the West Coast. I'm here on the East Coast, so it's 11 o'clock for me. Heading on into soon to be lunchtime. I have been a big breakfast skipper the past few weeks. I've just been drinking my coffee and not probably eating lunch until like 2 o'clock in the afternoon. For me in the US, it's 11 a.m. So it's still it's getting towards lunchtime. It's actually quite a bit earlier on the West Coast of the US. I have my HealthCon t-shirt on today from 2018 HealthCon Las Vegas. I like this one because it's got the little Mickey Mouse here on it for the HealthCon logo. Hey Sue, hey Raj, hey Kenya. Welcome to the live stream. Glad to have you guys here today. So one of the things I wanted to talk about in between some of the questions is I've had quite a few people saying, Victoria, you've really inspired me. I kind of want to do what you do. And I want to talk about how I got where I am. And if you guys, just a spoiler alert, Tony L. Holmes is going to be coming on to one of my videos, not live, but one of my recorded videos later in the month from Alpha Coding Podcast. She's phenomenal. And she's going to be answering some great questions. I know she gets asked a lot how she got to where she is, doing all kinds of legal stuff in the medical coding realm. And I'm really excited to bring her on and pick her brain a little bit about how she got to where she is as well. Someone's asking me, why is it so important to be able to identify accent symbols in medical terminology? I'm taking the online AAPC course, and every chapter review exam asks at least 6 to 7 questions about that. I've not taken the AAPC's medical terminology course, so I can't really specifically say about that. Honestly, when I took medical terminology, I didn't have anything in regards to accent symbols. Mine was literally a lot of memorization. I was taught by a nurse at a community college, and she would give us like 10 to 20 terms every day. She would talk to us about them. She would write them on the board. We'd have to copy them down. We'd take quizzes. It was really just very question and answer. So I'm not really sure about the accent symbols, because that's honestly not something that I've ever kind of been questioned about. I don't know if those of you in the chat have maybe gone through that before with your AAPC courses and could maybe speak to it, but I'm not too sure about some of those accent symbols with MedTerm. MedTerm for me has always been more of a memorization thing, and honestly, my core thing with MedTerm is memorizing your prefixes, your suffixes, and being able to combine them. Because once you know kind of the prefixes, the suffixes, and then that core term, you can combine just about anything together and piece it together. The other important thing to know is, even though you're not allowed a medical dictionary with most of the AAPC exams. I think there are a couple exceptions, but the CPC are the biggest one. You can't. There are some ways that you can, depending on what edition of the ICD-10-CM manual you have, there's a lot of terms in there through some of the diagrams and things. Marissa, so you may be able to find some of the, especially like the blood flow of the heart. I found that a lot of the manuals have diagrams about the blood flow of the heart, and they like asking questions about that. So if you know where that diagram is, you can piece together the blood flow of the heart, because I don't have it memorized myself. It's not something that I use frequently, so I just don't remember exactly off the top of my head where the blood flow of the heart goes. But yeah, Marissa's saying it's to properly pronounce the term, so that's probably why they want you to know the accent symbol, so that you can speak appropriately when you're speaking to a doctor or something, and maybe calling them on the phone, explaining to them about an addenda or something you need in the medical record, that you sound very professional when you're explaining things in regards to medical terminology and using the terms appropriately. So that I can see if you're verbally speaking them. Can I explain how to code for multiple codes for CPT? So I can do a video on that. I really can't do that live because there's a lot that goes into that. There's a lot of just reading through the operative report. And honestly, depending on what kind of operative report it is, it might take me 20, 30 minutes. I mean, I've had sometimes where I've had very complex cardiovascular ones where, you know, because I don't do them frequently, it could take me easily 30, 40 minutes till I piece it together and check the CCI edits and stuff. So if you have specific cases that, I shouldn't say specific cases, but specific types of scenarios that you want me to cover, comment, because I do read my comments. I see those kinds of things that people say. And if I can find case examples that I can utilize and show you, I will certainly do videos like that. I could make a whole video at some point, you know, coding for multiple CPT, probably surgical procedures, I would assume, and how to apply the 51 modifier, how to verify if anything's bundled. That might actually be a good topic. But, you know, the problem that I run into is when we're talking about case examples, you know, there's a couple of ways to source case examples. We could take them from a book, but I don't have the rights, so I can't just take a case from Step by Step, because that's their material. They own the rights to that, and just show it on the internet and be like, here's this case. You know, I've gotten permission from the AAPC to show a couple of things that I have in their curriculum. And the other thing is, you know, I could say, oh yes, send me some cases, but you as a coder don't own the provider's documentation. So you can't just say, here, I'm going to take this document that the provider developed and provider owned and just hand it over to you to monetize on your YouTube channel. So while I could maybe take some things and mock up something similar, to do it from scratch as a non-clinical person is a little tough, but I just try to be very careful about where I'm sourcing materials from, which is why oftentimes when I do case examples, I take them from the Medical Transcription Samples website, because they say, you know, hey, you can go ahead and use this as long as you refer back to us and cite back to us. So, any advice on organizing books for the test? With the CPC exam, I do have two tabbing instructions for CPT and ICD-10-CM. You can check those out on my channel. Tabbing, I think, is really important. One of the key things I always think too is make sure you tab where you put your notes, because you don't want to be trying to remember exactly where that is in your book as well. Some people like to do tabs on 2 sides. I've seen some people put them on 3 sides, but I think then if you're trying to transport your book and you're sticking it in a bag, you know, one side is always going to have to be hitting in a bottom of a bag or a carrier or something, and you don't want all your tabs, like this one right here, is all pushed down. So it's not going to be very convenient for me to try and look something up when I can't even identify where that tab is because it's folded down. So tab down the sides, tabbed up on the top. And yeah, the video that I have can help you identify some things. ICD-10's a little bit harder because there's a lot of different editions that people can use. So, you know, there's some general guidelines of how to organize the tabs, but as far as giving everyone exact instructions, turn to this page, put this tab here, you know, that's a little bit more difficult. CPTs aren't too bad. I actually don't think I've tabbed my CPT book yet for this year. And, you know, I only really did it last year for the purposes of that video instruction, but with the CPT book, the edition that you have to use for the CPC exam does have these tabs that come into it, and you can use them. I see a lot of people will say that they put them right where the little white bar is, but depending on kind of your preference, I usually just line them right down. Do I happen to know anything about the extern internship program through the AAPC? I know they do have one, Project Extern. It is a little bit limited because it's hard to find locations. And that's one of the things, if anyone knows anyone or has experience with what's going on in the world of COVID with internships and externships happening virtually, I would love to get some information on kind of the experiences with that. Let's see, what else have I got here? I'm about to take my exam next month. If I pass, I'm afraid of not being able to code in the real world. I know there's no multiple choice. LOL, any advice? Practo Code. One of the things I think has been very helpful for medical coders is going through the Practo Code. Practo Code didn't exist when I became a CPC, so it's funny, I was just going through my paperwork looking for something yesterday and found my old apprentice certificate. So when you become a certified coder and you don't have 2 years experience, you get the apprentice designation and they send you an apprentice certificate. And then when your apprenticeship is removed, they send you a new certificate that doesn't say apprentice on it. And I found I had my old apprentice certificate in there and my paperwork from when I had my apprenticeship removed, because back then it had to be 2 years experience, or you could do the 80 hours of education plus 1 year of experience. And we didn't have Practo Code back then, so you couldn't take it off with then. So I've not had experience with it because it wasn't an offering back when I became a coder. But I noticed they have specialty modules, so I did sign up for their surgical specialty module, and I'm kind of working through that now. And honestly, I think that is a pretty good way to learn how to do the real world coding, because instead of it being multiple choice, they basically give you, boxes, and they're just like, fill in the CPT codes and the modifiers here. And I think that does help. Another thing you can do is instead of you can go through practice exams and just not look at the multiple choices and start kind of feeling out how to code them, just like raw coding, I guess we could call it, and see how you fare there. There's going to be a grace period. Most organizations, at least most decent organizations, aren't going to expect you to come right off, guns a-blazing and start coding things. They're going to typically partner you up with someone else in your department or your supervisor. And as you start coding through things, they'll look at some of your accuracy and say, hey, this code isn't this because there's this CPT assist that you weren't aware of. Or, we talked this out with the director and we felt that, this is the best way to code for these kind of scenarios. So there will be feedback, there will be involvement. Most good organizations aren't just going to kind of go, here you go, start coding stuff and go. Or at least they'll give you a grace period with your productivity. Like if we know that you're a new coder and you're not going to be able to code 90 charts in a day, but if you could do 20, 30 and then work your way up to the 90 charts a day, that's more of what I've been seeing. Good morning, everyone. Good morning, Lisa. Good morning, Mary. But yeah, I think I want to show some experience that I have with the Practo Code, with the specialty module, to demonstrate not, everything that's in there and how to code the cases, but to give you a feel of kind of what it looks like and my opinion of how I would feel about the Practo Code, because I do get questions about that quite a bit. I've gotten a couple of questions I'm seeing about the ebooks with the AAPC, and I'm not quite sure the difference between the ebooks that I have with the AAPC versus the ones that they're giving for the exam, because it sounds like some of the ebooks that you guys are getting are in Blackboard. Now, I recently hosted my CRC boot camp to prepare people who are already trained in medical coding or looking for a secondary credential, specifically wanting to get the CRC credential. And I was able to offer ebooks to them as an instructor as part of being in the course. And those ebooks came through the Bookshelf app. So I don't know if the ebooks you guys are referring to are through the Bookshelf app or through the AAPC Blackboard, which is different. The one that I have through Bookshelf, you can't print. I don't know. So that's why I'm kind of like, I know some people have said, oh, I've printed them, but I don't know if they're referring to books that they had through their course 3 years ago and were able to download the PDF and print them. But I just wanted to show you guys real quick here. And actually, let me go back. So if you are on the Bookshelf app, like you have one of the ebooks that's actually on the Bookshelf app, what you can do here, let me get my camera rigged up, is I actually have mine on my Amazon Kindle. I know that's not the best shot there. If I was super tech savvy, I would probably have this hooked up through some sort of cord and it would just display. But if you can download the Bookshelf app onto your Amazon Kindle, which makes it a lot easier to read that way. And then I can get into my CRC study guide, and it's just a lot easier to read it that way. Plus, you can make flashcards to study with. You can highlight things. You can write it. So it's a little bit easier than having it just on your desktop, because at least I can take my Kindle and walk into my bedroom and read it this way. Versus, I can't take. It's a little harder to take a desktop computer or a laptop in there. So if you're an Amazon Kindle user, I think it's version 4.0 and higher, you can download at least the app through your Amazon Kindle, and that's a little bit easier to read some of those ebooks. Victoria, you mentioned CPT Assist. What is the relevance to it when reviewing a code? Oh, hold on, I'm not putting my CPT book away then. So CPT Assist, if you go into your CPT book, and so here, and I'll move my light so you can see this a little bit better. If you're here in your CPT book, let's get this a little clearer. There's these little references here. Like here's one that says for code 52204, CPT assistant may 15, and it gives the references to the dates and times and editions that they have those CPT Assist. Same here. CPT Assist, September 0011, January 01, May 01. And the CPT Assist is a publication that is put together by the American Medical Association. It's not something you will find in the CPT book. It's a separate subscription. They have it on their AMA website. You can get the archives for them, and it's basically official coding guidance that's not published in the book. Let's see if we can get over here. Face. Right. Are we going to do that? Are we going to do that? Or are we not going to do that? What are we doing? Screen left. Here we go. We'll do it this way. So, AMA CPT Assist. It's a subscription service that you have to get. A 1-year subscription where they're basically just going to send you CPT Assist is one fee, but then you can also get the archive so that you can go back to everything that's in there for a larger fee. So here it's a subscription, almost like a magazine that they send out. It's $199 a year to get the 12 monthly issues. If you want the archive though, where you can get all of them, it's a little bit more to get the entire archive. Let's see if they have it in here. Print subscription. CPT. Usually they bundle it in with encoders. Like if you have a coding search tool, you can go ahead and add in the CPT Assist archive so that you can find those definitive coding guidance for certain codes. Let's see if I can find a CPT Assist archive, and that way you can kind of search through. You can search by code and find those more detailed guidance that the AMA has published in regards to utilization for those codes. case scenarios that they have on there. Like I have AAPC Codify and I can add that on, but I think it's something like, let's see here, Code Connect, that's not it. CPT Assist Search. So yeah, it's there's a way you can add that on. It looks like $199 per 12-month subscription. But yeah, so it is something that you'll want as a coder. What happens in most organizations is they don't give access for everyone to search through CPT Assist. They'll maybe give like 1 or 2 people access, and then if you're like, hey, I'm not sure about code 52005, it says there's a CPT Assist. Can you pull that for me so I can look and see what the heck is going on, if there's some sort of information regarding that specific code and guidance that I need to know so that I can code this case accurately. For the purposes of the CPC exam, they're not going to test you on guidance that's in CPT Assist. They're only going to test you on things that you can ascertain from within your CPT manual itself. Natasha, thank you for saying your wonderful comment about the CRC bootcamp. Yeah, I think it's good, and I'm really excited because I know they said on Social Hour recently, AAPC Social Hour, that they're going to move some of the additional credentials online, I guess, by the end of second quarter. And I know CRC is their second most popular, so I'm excited to see like if that's going to be coming up soon. I have a good feeling it probably will. Lisa's asking, I don't have a lot of tech or computer experience relevant on my resume. Will that make it challenging to achieve employment as a coder? Any suggestions? Would a Word Excel certification help? I think most employers now are kind of expecting that employers are going to have a baseline understanding of Word and Excel. I don't think you necessarily need a certification, but I would seek out some courses that you could maybe take on Word or Excel, even just YouTube tutorials. You know, there's a lot of things that you can learn for free online now, and Word and Excel are definitely one of them. So I would just check around to see if you can find something online that you can get for free. If not, there's places like Udemy and what's the other one used? Teachable? Is it Teachable? But there's a couple of online course places that you can go and get some affordable online education in things like Word or Excel for, you know, $20. I wouldn't invest a ton of money into something like learning Word or Excel unless you can find a certificate program online through like a community college that they're like, hey, we have this, you can attend for, you know, $50 or something. Barefoot Farm, I find it difficult navigating CMS MAC jurisdiction in Noridian policies and guidelines on documentation for some scenarios, assisted surgery, surgical, skilled nursing facilities, etc. Yeah. So Noridian, I know I've been on the Noridian website a little bit, but not too much. Let me see if I can get onto the Noridian website here for you guys and see what I can do. So let's get over here. Screen left. So this is the Noridian website, and it looks like a lot of them oftentimes have search boxes. That's what I'm looking for first when I am on one of these websites, is I'm trying to see if there is a search box I can use. And it doesn't look like they have one. Yeah, this looks like it might be a little bit more of a difficult one to navigate. So Jurisdiction E, Medicare Part B. So here's their active LCDs, latest updates, education and outreach is something. Hey, thanks for your purchase. Someone just purchased one of the V-neck t-shirts off the website. Yeah, if you haven't seen some of the merch, I added in, there's a really cute one for St. Patrick's Day, and if you want it, you should probably order it now to make sure it gets there in time. But I'm going to be wearing them that next month for my St. Patrick's Day special episode. It says lucky to be a medical coder, and it's got a cute little 4-leaf clover on it. I would get on to some of their schedule of events it looks like they have here. Ooh, look, CEUs. They've got CEUs for Noridian. Everyone pay attention to that. So they've got CEU and they've got continuing education stuff here, webinars. So I would get on to some of their events, and if there's specific questions you have, start asking them. Like here, I don't know, I've not signed up for some of their stuff. Basics of provider enrollment. I don't know why these you can't click on, and these you can. Maybe these are closed for enrollment. I'm not quite sure. But let's see. Provider enrollment live chat, ambulance basics, telehealth. Let's click on this and see where it takes us. So it looks like maybe these they don't have available to sign in anymore, but you can sign in, and it looks like they do these on GoToWebinar, and you can get some education for Noridian specifics that way. Let's see if they have an outreach and education here. Tools, acronyms, new Medicare cards, CMS.gov links. Yeah, see, this one, it doesn't look like... Oh, here we go. Here's a search box. Yes, I found a search box. Here it is. I missed it. Evaluation and management. Anything. Give me something, Noridian. Okay. So that's what I would do. When I try to find something on a Mac, the first thing I look for is a search box and start searching through the search box. And if you can't find what you need, start getting into some of this outreach and education information here. Get into their schedule of events, try and ask them questions. You can even, if you're involved with your AAPC chapter, you can request that someone from your local MAC come and speak to you. So get in touch with your local chapter and see if they are having someone from Noridian come and speak at your chapter and ask them, hey, these are the things I'm having trouble with, skilled nursing facilities, etc. The other thing you can do is oftentimes, I know my MAC, Novitas, we can request that they come and do specific education for our organization and have them do that via whatever virtual application they have, Zoom, etc. Or we've actually had them use our Zoom applications in the past to come and do presentations. So those are the two things I look for when I'm checking any Mac, a search box and that outreach and education button. Faye's asking, hi Faye, is it better to get specialty after passing the CPC exam? Yeah, I think a lot of us, though, tend to fall sometimes into specialties. What I've found a lot of times is, you get into coding, you take whatever position you can get, and they're like, hey, we're going to put you into general surgery. Great. So you learn a lot of general surgery, you may like it, you specialize in general surgery. At that point, I would go and get like a specialty certification in general surgery, or if that's something you enjoy. If you get into general surgery and you're like, I don't really like this, and you're more interested in cardiology, then maybe start studying up on cardiology, offer to cover for the cardiology coder. And at least that works in larger organizations. Smaller organizations, it can be a little bit harder to kind of finagle those sort of things. But the more you can, there's two aspects of being a coder. So you want to have general broad knowledge so that if you're in a situation where you need to switch coding jobs, you know at least a little bit about everything so that you can be marketable. But sometimes when you can niche down, especially in some of these things like interventional radiology, when they're looking for someone specifically for that type of coding, there tends to be a better income because they're niching down as well. They're going, we need an interventional radiology coder, so they're only looking for a select group of coders. They can't pick someone out of anywhere because they want to make sure that they are getting someone specialized in that area that's going to make them the most profit, identify the most errors, make sure that they're the most compliant. And if they can find someone who's just in that niche, they're going to go, this person's worth a lot, we're going to pay them more. So there's benefits to having a specific niche that, when someone's looking for someone specifically in that niche, that they'll target you and want to pay you more, but then also making yourself marketable, having a general knowledge of a little bit of everything in medical coding. Where do you recommend applying first after passing the CPC exam? I'm seeing some things about, where to get jobs. I'm actually going to be making a entire video soon, how to find a medical coding job in 2021. But one of the first things, and this is one of the first things I always like to show. And let me just fix some of my settings here right quick, because this is driving me nuts. Webcam and left screen. There I am. So if we go to codersdirect.com, that's one of the first places I always tell people to go is on codersdirect.com because it's a specifically for medical coders and medical coding jobs. The other thing is if you have a specific hospital or organization near you that you want to apply for, like near me is Tower Health, Lehigh Valley Health Network, Lancaster General Health, I would go directly to their websites and check their career listings. You can narrow it down first by things like the term coder or the term CPC. And if you can't find anything, you can also just scroll through their entire listings, or, you know, the entire support staff or admin listings, and see what they have there that you may qualify for. But the other thing that I love, though, is Coders Direct. So, see, now that one, it didn't do it. Why are you doing this to me? Webcam is... There we go. I need to fix some of my settings. So Coders Direct is a great website. You can go here, and if you're newly certified and you're a certified coding apprentice, you don't have experience yet, what you want to do is, especially if you're looking for remote work, you can type in remote work. You can type in by location if you're looking for something on site. And there is a designation here for the CPCA. I believe there's also one for the CCA, which is the AHIMA apprentice certification. And what you can do then is just search, and you can bring up basically every single job that is willing to take a CPCA, meaning a Certified Professional Coder Apprentice. I'm going to also, you know, I need to hook up with this chick from, I shouldn't say that, chick from Project Resume. I can't think of her name off the top of my head. Ann Barnaby. Because she would be a good one, I think, to bring on and talk about some resume tips as well. So if you... That did go, maybe it didn't. Was that show? Okay, that was. Okay, good. I wasn't sure if this was showing Noridian's website or Coders Direct. It was Coders Direct. Okay. So that's where I would go. Those are the two big places. And then also Indeed.com, you can just search by location remote there as well, and search for things like CPCA or CPC or medical coder, and start looking for jobs that way. That's where I would kind of start your job search. Can you tell me if there are any free medical terminology classes online? Yes. MedTerm, there's JJ Medicine. Go onto YouTube and type JJ Medicine. That is a free medical terminology course that you can take. There's also a great resource for anatomy and terminology called Crash Course. So go into YouTube and I'll show you. So this is what you're gonna look for. So if you go into YouTube and you search JJ Medicine, this is the one that does free medical terminology. Great resource that you can utilize there, as well as if you type Crash Course A&P, this is the entire anatomy and physiology series that they give for free online. It's absolutely amazing. And this guy, I didn't even realize it. Somehow the TikTok algorithm is so smart sometimes. And, you know, it's nice to see something other than Garen Nolan videos showing up on my feed. But if you can get on TikTok, this guy is on TikTok and he does these really cute videos. They're just like so amazing. But they have this whole anatomy and physiology course that you can take for free on YouTube. Now, the difficulty there, though, is there's no quizzes, so you can't test your knowledge, but you could also maybe get like a supplemental book or something that does have some quizzes in it and utilize that. But those two channels are fantastic for MedTerm and anatomy and physiology. I could never do anything with A&P as well as Crash Course does. Is there a cheat sheet for the new E&M 2021 office coding? And if you've been off Novitas for a while, how do you get back into Novitas? That Novitas website is something else. They will lock you out after, 10 days of not using your account. There is a password reset. It is sometimes difficult. I think I found that the last time I forgot my password, I just had to set it up under a different email address. You can request a new password, but it does take a couple of days, I found, until you get it in. I have a friend that used to work for Novitas, so he's offered in the past to kind of push my things through the process. But yeah, what was the other thing about Novitas? Oh yes, so Novitas does have a new E&M grid. It's not that great. Like, they changed their virtual grid that they have. Let's see if I can find it. Novitas Solutions. Because it's basically, it doesn't actually score anything. It really is just what's the level of risk, what's the level of diagnoses, what's the level, you know, and then you go, oh, moderate, 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 oh, it's a level 4. So let's see if this is the right screen I want to be at. So here's the Novitas Interactive Score tool. Does the documentation for services build me the date of service? Yes. Accept. Beneficiary name. We'll put in here test. Date of service 0203. We'll say it was yesterday. Chief complaint. Continue. Oh, is this related to an office visit? Yes. There we go. Almost missed one. So what it does now on Novitas for the interactive score sheet, you either select new or established, and then you can select based off of time if you need to do time, and then the medical decision making is basically like you select, was it low, moderate, high, you know, minimal, low, moderate, high, minimal, low, moderate, high, and then it will spit out the E&M code for you. So not super intuitive as far as being able to kind of check boxes and go, yeah, I got this, and it helps out with the code. It really is not that intuitive. There is, if you go to the last video that I did with the E&M coding cases that I published on Tuesday, there's a link in there that WPS has training, and then I link in there the AMA grid that they have, and one that you can download through the AAPC. So let me see. AMA E&M 2021. Now keep in mind though that I don't believe that they will allow you to take this into the exam with you right now, unless you're specifically going for, and I don't even know how they're handling that right now for the E&M training, the E&M specialty certification. Let's see what we got here. E&M office visit changes. Here we go. Oh, look, they have a whole training here, slides and everything. Let's see, E&M 2021 score sheet. E&M 2021 score sheet coding Intel. Specialty exam score sheets. Nope. 2021 evaluation and management score sheet. So there's the training module, but where's my score sheet? There we go. So this is the score sheet that the AMA put out. It is in your CPT book for 2021 in pages 16 and 17, but you can review it here. They do have training modules online, and the AAPC one is linked in the video that I did on Tuesday. We need to get together and make a study group online. I miss people. You know, I know there's some on Facebook. Someone messaged me the other day. Actually, I think I got a couple of messages the other day that someone was promoting a lot of my videos and stuff on an online group, which was extraordinarily flattering. And I did see quite a few subscribers peak at that point. Yeah. Let's see what else we've got in the chat. AAPC CRC course has online reading textbook, no more physical book. Do you know what book they are using? Sherry Post. For the AAPC, they use a study guide. I thought they still had physical copies. They're showing online at least that you can purchase them. They maybe just include them because the ebooks, you know, it's cheaper. But I was showing earlier that I actually have, and I found this easier for myself. I downloaded the Bookshelf app on my Amazon Kindle. I'm a Van Gogh fan, if you guys didn't know. I don't want to get too sidetracked, but it's funny. I have a P.O. box that I set up for my business in case people need to send me things, or they're like, hey, Victoria, I made this cute thing and I want to send it to you. I haven't checked my P.O. box since the pandemic started. I think I did once. I shouldn't say that. I did once, and there was nothing in there. So I don't know if they're sending all my mail back or what. But I should reopen my PO box in case people are trying to send me. Because someone did say at some point, they're like, "Oh, I have this funny pen I want to send you," and I'm like, "Okay." But in any case, yeah. So I'm a Van Gogh fanatic. I love Starry Night. And you can download, if you have an Amazon Kindle, you can use the Bookshelf app on your Amazon Kindle and put your ebooks to the AAPC on the Bookshelf app that you have there, and it makes it a lot easier to read. Even just the formatting of it, because it looks like a whole page, not more like you're scrolling your eyes through the entire desktop or screen of your computer. And that way you can, you can't print it out or anything, but at least then it's a little easier to use. You can digitally highlight things, write notes, and do flashcards. So yeah, I would recommend, if you have a Kindle, use it that way. The other cool thing, the one cool thing though about the ebooks, guys, I don't know if you know this, it'll read them to you. Like there's a setting that you can do on the ebook. I know it does this on Kindle, and I'm sure it does it on the desktop too, but you can just have them read you the book. Like it'll just go through the whole audio. And some of them it's funny because they pronounce some of the abbreviations or something oddly, but it is actually kind of helpful to have the reading. Do you have to become a CPC before getting a CRC? No, you do not. I will warn, though, that the CPC program is probably a little bit more robust in some cases than the CRC. CRC, you would still need to go through MedTerm. You still need to know anatomy and physiology. You actually need to know, I would say, a bit more pharmacology for the CRC, because you need to be able to validate if a diagnosis is active or not. And one of the ways you can do that is by checking if a medication that they're using correlates to that diagnosis. So you can absolutely, I've seen plenty of people get their CRC before they get their CPC. Just know that it's not going to be, the need for CPCs, the jobs that are looking for a CPC are more so than the jobs just looking for CRCs. So, if you're getting into risk adjustment, just understand it's going to be because you love risk adjustment, you love ICD-10-CM coding specifically because it just works with ICD-10-CM. Just know that the job search might not be as much, but oftentimes they're hiring, huge batches at a time. They're like, oh, we have this 9-month risk adjustment program. I think I just saw one the other day that was like, we have this 10-month program. We need a ton of risk adjustment coders. They hire like 50 or 100 to work on a project for, a 9-month, 10-month span. Is there a reason why you're not answering my question about the NCCT exam? Nope, just didn't see it in the chat because I'm going through a lot of stuff and there's a lot navigating. I don't know if you know that about live streams. There's a lot to navigate. I actually don't know anything about the NCCT exam. I have never heard of that one before in my entire life. If you could give me some more information about who that's even from, because that's not one I've ever seen an employer kind of ask for. I'm not really super familiar with the NCCT exam. I apologize. I really I don't know anything about the NCCT. Where is this in my chat again? I just lost it. Is there an NCCT? Yeah, I don't know anything about the NCCT exam. If anyone in the chat knows anything about the NCCT exam and could help this person out, please do that, because I honestly, that's not one I've heard of before. Particularly. Let's see. Oh, Natasha says she has the Bookshelf app on her phone and that works good too. Yeah. So that's awesome, because then, you have your phone with you everywhere. Anatomy and physiology I talked about. Have you handled supervisors or providers instructing you to code services that documentation doesn't support? Oh gosh, Barefoot Farm. So let me tell you guys a story. So story time. When I worked at one organization, I coded for plastic surgery, and we had a very big bariatric program. And one of the things we dealt with then, because we had patients losing massive amounts of weight in plastic surgery, was patients were coming in for excess skin removal. Now, there is a code for removal of your excess abdominal skin, an abdominoplasty, which is basically them just taking out whatever the excess skin is that hangs over your abdomen and cutting it out. And, that's what insurance is paying for, just to remove the excess skin. Not to give you a tummy tuck where they suture in all your muscles all tight or do liposuction, but just to remove that excess skin. And what happened, though, is my providers would state that they were doing flaps. They'd say, oh, we're doing these adjacent tissue rearrangement codes. And if you're familiar at all with adjacent tissue rearrangements, they are add-on codes. So if you're doing a huge area, like someone who has flaps down to their knees of skin, it would be a substantial reimbursement. So I was in a situation where I was being told by my providers, well, yeah, these are flaps because there's just so much extra. It's not just going to be an abdominal surgery. It's going to be an adjacent tissue transfer or rearrangement, which is not what those codes are for. And was put in a situation where I was told, yeah, you should still code them out. It's going to be, like 100 RVUs for one case, more than heart transplants get reimbursed. And, there was one provider that sided with me. There was other providers saying, no, we can code it this way. The Association of Plastic Surgery was saying, no, you don't code it this way. When it got to the point where I just did not feel comfortable about it, I took myself out of that situation. So I wish I had a better way that I could tell you, oh yeah, this is how you persuade them to see your way. But there are certain situations where it just doesn't, and that's where you kind of need to start worrying about getting yourself out of that situation. Now, what I did, so that I can tell you what I did at least that might work in your area, get your CPT assist, go to your association. So if it's a general surgery thing, go to the American College of General Surgeons and see if they have a stance on that, something that you can take to your providers, to your supervisors, and say, hey, this is the scenario we're seeing. I presented the same scenario to the American College of General Surgeons, and they have a stance on it. Here it is, and you can see where it is. But yeah, if you're getting into a situation where you've continued down that path, and things are still continuing to look non-compliant, and you're being asked to code things incorrectly, you could maybe even ask your supervisor, like, hey, because I don't agree with this, could someone else code this and I do something else, or can you put these codes in? Or the other option you have is to just document and say, per my coding supervisor, Mary, I am to assign code blah, blah, blah in these scenarios, so that at least that covers you. I know a lot of coders worry, like, oh, they're gonna take my credentials, but that's something the APC doesn't want to take coders' credentials. They do that only when they can really prove that there was an obvious intent to do something malicious, that you knew otherwise and were just kind of recklessly doing things. I've even heard in the past that they've said, when the ethics committee looks at scenarios, if you will even confess up and say, like, oh yeah, I did this wrong and I know it was wrong and I'm sorry, I'm going to make it better, they look at that even more favorably than someone who's going, well, no, that wasn't my problem, and blah, 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 when they obviously did something that was very incorrect. But yeah. Ronnie, can you please answer my question about a coder being rusty in coding but certified? I did not see that one. I apologize. There's a lot of questions coming into the chat, and I'm trying to get through a lot of them. Yeah, if you have a question that you need like super duper answered, there is a super chat option. Not saying you have to, but that does alert me that there was someone who kind of paid a small amount in order to have their question answered, and that goes to the top of the listings and draws my attention so that I can see it. Again, not saying you have to, but question about coders being rusty. I will get to you, Ronnie, because I know you're here all the time, and I appreciate you for that, but I'm not seeing where it is in my chat. Let's see here. But yeah, just in general, in regards to coders being rusty, the one of the things you have to do is really keep up. Sometimes we as coders, we get certified, have trouble finding a job right away, or something happens, you get pregnant, you have a family member that's sick, you have a lapse, and you need to brush up on your coding. Guys, Healthcare Business Monthly, if you're an AAPC member, you get this every single month. Go through it. You can get the information that's pertinent, things that are currently going on in the industry, lots of good information. Someone asked me recently about, is this something I'm supposed to be getting as a member? Yes. What the key thing though is, again, we're trying to not ship as much stuff. We're moving into this digital world. So the AAPC, what they do is everyone kind of defaults to a digital version. You can go onto the AAPC website, and there is information in there about how to. There's an entire archive. There's an entire archive under, gosh, I can't remember. It's under, I think, education and additional resources, and it says magazine Healthcare Business Monthly. There's a box though in your account settings, and I don't want to open up my account settings and show you because it'll show my member ID number, and that's not something you should kind of openly share on YouTube. It's one thing to write it down in a meeting that you're doing and attending, but another thing to put it all out there on public. But in any case, if you want the paper copies of Healthcare Business Monthly, you go into your AAPC account, and there's actually a box you have to uncheck in your account in order to get the paper magazine in there. So that's a good resource, is to read through your Healthcare Business Monthly and make sure that you get that information, because there's a lot of pertinent stuff in there. The other thing you can do, go to your chapter meetings, make sure that you're getting information from there. There are Practo Code specialty modules you can purchase if there's a specific thing. Look, who's that? Who's that? It's not coming up right. But yeah, that's I did an article for Healthcare Business Monthly this month. You can buy the Practo Code specialty sessions if you want to go specifically through a certain specialty and code out some cases. You could go do practice exams again just to make sure that you're brushing up on things. Take those free CEU courses, go to hitnots.com and see what education they have coming up that you can participate in and get information. Oh, you know what? So you just mentioned about teaching classes. Funny, I actually finally just got some clarification from the AMA, and they said that as long as because my concern was, I'm trying to be very respectful of the fact that they own the rights to CPT, and I do not own the rights to CPT, and I can't just share CPT content, tons of it freely as much as I would like to everyone. But I also, as part of teaching, want to, as I'm teaching people, show you, follow along. Here's where in the video, here's where the CPT book is, and here's, follow along with me, watch my finger, and we're going to go through, and we're going to, go here, go here, go here, go here, go here, and this is what this says, because I think that's a better teaching experience versus me just sitting here with my CPT book going, and, okay, go. We're on page 411. And on the bottom right, it's easier to see it, right? It's more visual. So they said as long as my students have the CPT book and I have the CPT book, that's okay. So I'm going to probably start pushing a little bit more forward with the classes this month, start getting the rest of the stuff recorded that I needed to for the class. But yeah, I appreciate that some of you have said that you want to put things together. I'm not a big Facebook group person. But if someone was willing to maybe moderate a group for me or something, I'd be willing to maybe set up a Facebook group if that's something that there's a lot of interest in. I will start as I'm progressing in my company, because I'm still getting a lot of baseline stuff together. But as I start progressing, I will start doing more things like having maybe some free coffee and coding, hey, everyone come on Zoom. Get your coffee. We're not going to have CEUs, but if you want to come and chat, talk about cases, that's fine. We can do that. I'm about to take the CSE final. I'm brand new to coding, so I guess I'm a blank slate. I took the practice exam in AAPC 3 times and can't get over a 58%. Can you help with any tips? I have a series of videos that I did last year on passing the CPC exam. Check those, because there's some good information in there about how to work through cases. Also, there's one that I just did, how to pass the CPC exam in 2021, and that has some information as well. I know a lot of people like Juan Nguyen. No, that's not how you pronounce that name at all, Victoria. What is wrong with you? But he has a really good YouTube series that he does where he just kind of goes through cases, and there's some pretty excellent resources that he provides there in cases as well. So a lot of people like him. He might be another one to check out. And if there's specific areas that you can identify that you're having struggles with, if it's, neurology or something, you can go back and, review those chapters. Also, read through those rationales. Like, that's really one of the things you really want to look at, is when you see that you didn't get a question right, go to the rationale for it, really read it over, piece, kind of backwards engineer it, go, where did I make the mistake? Why did I make the mistake? And identify the information that you got wrong, and figure out, how can I correct this? Why was my thinking wrong, and what was the right thinking? And kind of get the straight picture from there. Yeah, I should do a CPMA program. I think it's in the works. It's planned probably sometime in 2021. We'll see. I just don't have the resources right now to pay for another licensing fee, but yeah, we'll see. I'm not sure what the AAPC CPMA curriculum looks like right now, because it's been so long since I took the CPMA. I think it was within the first year or two. Actually, I have it right here. It was in 2011 was when I took my CPMA. So it's been a decade now since I've taken it. So there's been, I'm sure, some transformations to the program since then. Yeah, you know what? I might, maybe I'll do that. Maybe I'll just come hang out with me. We'll have Zoom. We'll have coffee. I'll have someone moderate to make sure that people aren't coming in and doing inappropriate things on their cameras. So once I can figure out some sort of appropriate structure to make that happen in a secure fashion, where I'm not just inviting every single person on the internet, I think that's something I'm more than happy to do. Just to say, come in and hang out with me on Zoom and we can chit chat. I know people are really about the Clubhouse app right now. I don't like being that selective, because I know not everyone can get into Clubhouse. Plus, I'm a video person, so for me to be on an audio only app, it just doesn't seem like something I'm ready to jump on right now. If I get to a point where it has picked up popularity and it is more inclusive of everyone, then I might start hosting some things on Clubhouse. But right now, it's just not an additional medium that I need to dump on my plate. That's already filled with, Twitter. And no, I'm not on Twitter. That's one that I don't go on a lot. TikTok, Instagram. I've been posting a lot of stuff on Instagram, YouTube, obviously. So, I don't feel the need to to pile something else on my social media platforms. But speaking of which, if you haven't already, you can join membership. I do have a paid membership program. I offer community-only posts. I do offer CEUs to my paid members. There's different tiers. My platinum level tiers actually get behind-the-scenes footage. They get some outtakes that I post on there. The gold membership and the platinum membership both get your names on the end credits of my videos, and then silver membership, you get the community only posts, you get the CEUs. So there are a couple of CEU courses that I offer just for the memberships for my channel. There's a little button down there that says join if you're interested, and you will still get whatever content. If you don't want to join, that's fine, but if you want to support my content, my channel, get the CEUs, that's something that I am happy to do. Mary Ellen, any local chapter meetings coming up for Allentown? The Allentown chapter has a virtual meeting coming up. There was a lady that reached out to us. I can't remember if it's March or April. I do have one other person that I'm going to reach out to soon, but we have no facilities for in-person sessions right now, but we do plan on having some. Hey, thank you for subscribing. Lead you. We do have some people that are going to be speaking virtually in the next couple of months. Exams were kind of playing by ear. I don't know if the rest of you are doing this with exams, but, we don't want to pay for $600 worth of hotel rooms for the next year, and then find out that LVHN or whoever opens up in the spring and they have space that we can use. So we're kind of playing it by ear, scheduling one exam at a time until we can kind of get through the year, get better ideas. But yeah, some definitely local chapter meetings are coming up for Allentown. I think March or April. I can't remember. Yeah, Mari, I'm talking to my instructor because you not knowing about the NCCT has me concerned that I'm going to the wrong school. Yeah, I apologize. I've never heard of the NCCT before. I can Google it right now, but that's not. Usually it's either anything with AAPC or a HEMA. I know that there's the CBCS that people get as well, which nothing against that. It's just not a, it's just not something that employers are looking for. NCCT exam. I'm seeing NCCT, National Center for Competency Testing. I don't know what that is. Medical Assistant Practice Test. NCCT exam. Let me see if I'm signing something for medical coding. I've heard of the CRCR. Insurance Coding, a Specialist Certificate. Yeah. Yeah. I'm not saying anything. I don't like to say anything negative about anyone's exams or certifications or anything like that. I think education is always definitely worth it. But if you want to get into medical coding as a medical coder, you want to get a certification through AAPC or HEMA, because that's what employers are really looking for. What's the difference between a CPMA and a CPPM? Certified Professional Medical Auditor is the CPMA. So that's someone who actually takes charts typically that have already gone out to insurance or are about to maybe go out to insurance, and we just want to scrub them and reviews them, make sure that they've got the right provider credentials, right provider signature, that it meets all the coding criteria, that it meets the insurance criteria, that it meets federal regulations. That the order was placed correctly in the EMR. That's what a medical auditor does. A practice manager is someone who works with the operations of that practice, making sure that providers are getting in, that they're getting credentialed, that they are, the operations of the organization are working well, that they're involved in marketing, they're involved in financials, they're involved in, provider interactions, that, if someone complains about the provider, they're the person that has to kind of handle that. Or if the providers are fighting with each other, they kind of have to navigate. They basically manage the entire practice or clinic. I passed the CPC in December. This was a complete career change for me. Aside from having my CPCA, what are some soft skills you use as a coder that could be identified as experience? Anything that you do with computers. So if you can work in Excel, if you can work in Microsoft Office, I'm trying to think how you would put it in as far as soft skills, those are kind of ones that are hard to put onto like a resume. If you've taken any kind of specific courses, like if you've taken a communications course, if you've taken something in public speaking, if you've taken anything in interpersonal skills, the AAPC does have a what do they call it? There's some sort of there's professional development courses that if you're an AAPC member, you can get to some of their professional development courses on their website, and you can take some of those as well to help develop your soft skills. I think soft skills are more something that you kind of have to present as you're doing your interview process and talk about them there. Do you think it's necessary to read the entire ICD-10-CM and CPT book before the exam? Yeah. I mean, they're books and you do have to read them. And I remember when I started out, I thought, oh, well, I don't need to read all these guidelines. I don't need to read, certain parts of it. But it is shocking sometimes when you actually sit down and read the book, like open it up and read it like it's a book, and find some of the information in there, and you're like, oh my gosh, I didn't even realize that there's actually instructions in here on how to select an ICD-10-CM book. So yeah, I do think that you should at least once read through the entire ICD-10-CM books and CPT books. Not saying that now, if I'm reading through the CPT book that I'm looking and reading every single exact word that's in it, but kind of going through and going, at least speed reading through some of the sections about the codes. But you definitely want to make sure that you're reading all of the guidelines and everything in there. I mean, I even still, having done this since 2007, will find pages where I'm like, was this here before? How long has this page been here? So yeah, I would definitely agree with reading through the book. I don't know what the heck that noise was. I am 4 minutes over, you guys. I was having such a fun time sitting here answering questions, but I don't want to go too far over. I'll take 1 or 2 more questions. 17-year-old future coder here. Yeah. Doing my medical term portion of my class, I'm having some trouble with memorization. Any tips? Flashcards are great. I've heard some people say that the Quizlet app online, that they can find MedTerm for Quizlet, and that JJ Medicine one that I talked about. But the whole thing with MedTerm is it's really just flipping through on the memorization, getting your prefixes, your suffixes, your core words memorized, and then you can piece together just about anything. Let's see if I have one more question. Any recommendations other than the AAPC CPMA study guide to help with passing the test? So this was something one of my coworkers missed, and I want to make sure I show you guys this because this is important if you're taking the CPMA exam. If you go into your certification listing here for the CPMA exam, under your section here for prepare for the exam, and then there's this button here, there's this link here that says additional preparation methods. Don't miss this because they're going to test you on some of this stuff that they list right here. ABNs, CERT, corporate integrity, NCCI edits. This is really key information. Excuse me. Key information that you do not want to miss if you're taking your CPMA exam. So now I'm starting to lose my voice, so I'm definitely going to go ahead and sign off. Thank you everyone so much for participating with me today. I am so glad I love that I had a lot of participants. Oh my God, there's 60. I was so busy reading the questions and answering. I didn't even realize I had like 67 people on right now. Thank you everyone for coming in with me today. Next week I'm going to be covering some awesome new videos. I have lots planned for 2021. If you haven't already, Instagram, TikTok, check me out on there. If you need Girl Scout cookies, my daughter has Girl Scout. Oh, where'd my Girl Scout cookie button's not working? What the heck? Oh well, that's not. Oh, wait, there we go. No, up. Yes, no, there it is. Yay! If you need Girl Scout cookies, you can have them shipped directly to your house. My daughter would really appreciate it. She's trying to hit 200 boxes. She's only at 96. If you can't, don't worry about it though. I'll see you guys back soon. And I might have to do that coffee and coding session. That sounds like a great idea. Thank you everyone for allowing me into your day, coming in and asking great questions. This was some awesome conversation that we had. I will see you guys next week with a new video. And until then, just keep on coding on.